Michael, I'm very happy to have you on board and to see your achievement with rapid extraction on site. So Michael is currently in the US, so don't. So it's very early in the morning for him. He's completely tired, as you see from his face, because he woke up very early today. But Michael, he is a very keen and good scientist who can give you directly experience from the field, as Bonnie showed his work in schistosomiasis, but he will show you a lot of work about Mycobacterium. So, Michael, the mic is yours, and all the best.
Okay, thank you very much. So once again, my name is Michael Frimpong. I'm working at Kwame Nkrumah University of Science and Technology as a lecturer and also as a research fellow in a tropical disease institute called the Kumasi Centre for Collaborative. My research is mostly focused on Mycobacterium ulcerans that causes skin lesions. I'll be speaking with you on our experience with using rapid extraction for DNA from skin lesions. And in this particular instance, we are looking at Mycobacterium ulcerans. I work mostly with neglected tropical diseases of the skin. And these conditions come with several forms. So you could have leishmaniasis, cutaneous leishmaniasis, you could have yaws, Buruli ulcer, leprosy. So there's a plethora of diseases, and they tend to manifest as skin ulcerations. And to be able to really pinpoint the specific disease we are dealing with, it's very important that you have a diagnostic method. And what is important for us is that these conditions mostly affect people living in rural communities far away from uh, hospitals and also the reference laboratories where the detection can be done. And so it was then important for us to get a diagnostic method that we can take to the field and to be able to, specifically with Mycobacterium ulcerans. So this is a mycobacteria that causes a disease called Buruli ulcer, which is a skin lesion. And it's in the same family as Mycobacterium tuberculosis or leprosy. But what is peculiar about this bacteria is that it produces a toxin. And this toxin has the ability to destroy the skin and the soft tissues. So in most of the patients that are affected, they tend to come out with these big ulcerations. And getting the right sample is quite difficult. When you sample for the bacteria, you tend to pick a lot of skin cells as background. And it's important that you have an efficient extraction so that you can get the DNA for the bacteria. By way of small introduction to this disease, so mostly this disease in Africa affects children under the age of 15. Very recently, we've seen it to be very common in Australia also, but it's in the elderly population. But as you can see on the image to my right, these lesions mostly affect the limbs, so the lower limbs and the upper limbs, but it can also affect other parts of the body. And they also present in different forms. The typical one is they will come as an ulcer or a wound on the skin, but most at times when you detect it early, it will not have ulcerated. And so also the sampling condition will be different in such case. So for Buruli ulcer, the control strategy really is for early detection, because what we've seen is that if the disease goes on undetected, it tends to cause major deformities because of the ulcerations that it causes. So most of the strategy for control, because we don't know the mode of transmission, is go onto the field, educate, try to find the cases early, and put in the right intervention, which is treatment with drugs. At the moment, we don't have a vaccine for it. So that is the strategy. And this strategy really hinges on diagnostics, because you need to be able to detect it early and then give the appropriate treatment. So on the field, we have implemented the RPA system on the Suitcase platform. And we have the two formats, the extraction kit, which have a magnetic stand and also a heating block to help us with the speed extraction. And then we have our amplification setup for detection using the T8 or the TS2 for detection. And then once we are able to extract our DNA, it goes through our dry reagent-based format and into our machine for detection. And like Ahmed said, the characteristics for a point-of-need diagnostic is, first, it has to be fast so that you can respond in time. And it's also important that cost is also factored in this plan. So the turnaround time and the cost is very important to us, and is the reason why having a cheaper extraction method is very important. And of course, most of these neglected tropical diseases are not supported by government funding. Is mostly through donor funding. So it's important that we keep the cost of detection very low. So what we did was to compare different extraction methods. So for us to choose the best extraction method, we try to compare different extraction techniques, and then based on that, take one method that we feel is very field applicable and also easy for us to do on the field. We compared the generalized extraction method, which from Hein, and was also very good. So this principal method is actually about 3 main steps. So you take our sample. So depending on the type of lesion that we take, like I said, if it has already ulcerated, we take a swab lesion from the wounds. And this will come with background of cells and other things because of the necrotic nature of the lesions. And these will go into our lysis buffer, and then we heat them up for 10 minutes at 95. We spin it down using a microcentrifuge, and then we take our DNA for amplification. We compare this with the SpeedXtract method, where either swab or the fine needle aspirate. So we take fine needle aspirate when the lesion has not ulcerated, when it's still an intact skin. So we go in with a needle, we take a fine needle aspirate, or if it has ulcerated, we take a swab. And then we add our lysis buffer in our beads. We heat it up at 95 for 15 minutes. We put it on a magnetic stand for the beads to attract all the other inhibitors and other background material. And then you have access to the DNA. And again, we compare this to our standard protocol that we use in our reference lab, which is the QIAGEN DNA protocol, which takes several hours, because like we said, we are dealing with a mycobacterium, and it goes through a process of lysozyme and proteinase K lysis. And this sometimes take up to about 4 hours for the extraction to be done. So we compare these two quick extraction methods to this standard 4-hour method, and we will show you the results in our subsequent slide. So the first thing was to look at how efficient these extraction methods were. So we compared first how much DNA we could get when we compare these 3 extraction methods. So we realized that with the generalized extraction method, we tend to have a lot of DNA, but this DNA is not only from the bacteria, you also have DNA from the background cells. So you tend to have higher DNA. With the SpeedXtract, we realize that we have a lot more DNA than even the PureGen extract. We're able to have a lot of the bacterial DNA as well as some cell DNA. But when you compare to the PureGen, which we tend to have very small amount of DNA, mostly bacterial DNA. And then we also compared how pure this extraction method is by looking at the exact DNA we were having, whether it's from bacterial DNA or background DNA. And of course, we realized that the PureGen gave us the best DNA purity, but for our field technique, we realized that it wasn't really a problem, because once you have the DNA in there, our RPA was able to amplify it effectively. And we did a comparison, as you can see here was the different extraction tests, and we realized that when we did it on a PCR and we look at the CT values, it was very comparable. No significant differences were observed. So what we did next was to look at the diagnostic performance by comparing the our crude extraction method, in this case, the SpeedXtract and the Genolyze, to the in-house PureGen extraction method from QIAGEN. And we realized that the sensitivity for both extraction methods was very good when it was done with the PCR method, up to over 90% sensitivity. And once again, we looked at the positivity rates in terms of using the SpeedXtract and the Genolyze for RPA. And very interestingly, we realized that the SpeedXtract with the RPA give us even a better result than even the PureGen extraction method on the field for the RPA. So just to summarize, I want to say that the SpeedXtract protocol was very efficient in extracting ulcerans RNA on the field, and it helped us to be able to take the diagnostics to the point of need for these patients who are very far from from our reference laboratories. We also saw that it performs really much better than the other extraction method for our RPA technique. And going forward, we want to explore this in the multi-center evaluation to be able to understand really how this assay performs. Thank you very much.